It's been a while. This is YouTube Medical University. Today's topic is natto. Doctor, I really love natto and eat it often. Many outpatient clinic patients who say this seem energetic, which may support my intuition. A paper was published in 2025. It's a study about natto and mortality rates. So, in the first period, I'll present the latest paper. In the second period, we'll discuss how it's expected to affect stroke, heart attack, and fractures. I'll talk about the amazing health benefits of natto. In the third period, we'll cover the importance of natto bacteria, antioxidants, and nattokinase. I'll clearly explain from a doctor's perspective why natto is considered good for your health. And finally, I'll also share my personal recommendation on how many times a week I eat natto, so please enjoy listening until the end. So, first, let's start with the latest paper published this year. A research team from Kansai Medical University and others, in other words, this study was conducted in Japan and was published in an international medical journal on nutrition. They conducted a 15-year follow-up study on about 1,500 elderly men in the community. Here are the results. In this study, when they compared the mortality rates between people who never ate natto and those who did, the results were surprising. A few packs weekly, meaning 1 to 6 times a week. People who eat natto, compared to those who don't, have a lower overall mortality rate. In other words, they're less likely to die. Their risk was about 40% lower. 40% is a shocking number. And it wasn't just that people who happened to be eating natto at that time had a lower mortality rate. Even in the follow-up studies, those who continued to eat natto consistently also tended to have a lower mortality rate. It suggests a link between natto and mortality rate. Eating natto lowers the mortality rate. Is that true? In the second period, we'll discuss natto and diseases like myocardial infarction, stroke, and fractures. We'll discuss the relationship, starting with vascular events, diseases involving blocked blood vessels. It's called the Takayama study, a large-scale study conducted in Japan. This research is also extensive. They tracked about 29,000 people for around 16 years, and those who ate the most natto. The group that ate it had a lower risk of dying from cardiovascular diseases than the group that didn't. The results showed that their risk was reduced by about 25%. And as for strokes, meaning cerebral infarction or cerebral hemorrhage, the risk of dying from these, the risk of death was also reduced by about 32%. And what's interesting about this study is that other soy products like tofu or simmered soybeans, aside from natto, did not show a clear association with stroke or myocardial infarction. In other words, it's not that any kind of soy is good, but rather that something unique to natto as a fermented food may be having a beneficial effect on the body. I'll discuss what that is in the third period, and it's not only about blood vessels. Next is about bones, which is especially important for women. A 2020 study on postmenopausal women showed osteoporosis, when bones become weak and more prone to fractures, which is common in that age group. The study focused on those people. In the study, those who ate at least 1 pack of natto per week were compared to those who did not eat natto regarding osteoporosis and the weakening of bones. The risk of fractures was reduced by about 44 to 48%, that's about half. Medical papers often report that people who ate this food had better bone density. Those results exist, but it's rare to see proof it actually reduces fractures. There are few papers that have a big impact or show important results like that, but natto actually reduced the risk of fractures. This is thanks to a nutrient called vitamin K2 found in natto. It's believed that this nutrient is important for bone formation and strengthening bones. We're starting to understand just how amazing natto is, but what I'm curious about is why natto is so good for your health. Actually, I'm also a huge fan of natto. I eat a pack of natto a day for about half the week. And because I love natto, the other day I appeared on a television show with Dr. Osamu Hayashi. I talked about the health benefits of natto. And, a bit embarrassingly, I also shared how I stock up on a lot of natto like you see in this photo. I don't just see natto as a regular food, but as an edible supplement, something essential. I eat natto, knowing I'm getting the nutrients I need. Why is it that only natto can lower the risk of death or disease? 3 components are believed to cause this effect, and I'll introduce them one by one. The first one is the well-known nattokinase. Nattokinase is also called an enzyme that dissolves blood clots, and it's also believed to have a positive effect on blood pressure. When nattokinase supplements were given to 73 people with high blood pressure, compared to those who took a placebo, those who took the nattokinase supplement saw their systolic blood pressure drop by about 5.55 and their diastolic blood pressure drop by 2.84. If you look only at the numbers, the drop isn't as dramatic as with blood pressure medication, but it does show that natto may actually help lower blood pressure. However, one thing to keep in mind is that this study was small in scale, and instead of actually eating natto, participants took nattokinase supplements, so it's not guaranteed that eating one pack of natto will definitely lower your blood pressure. This isn't definitive, so use it as a reference. Also, be aware of one more thing. Natto usually comes with a small packet of sauce, but some of these packets contain quite a lot of salt. Since salt can raise your blood pressure, it's good to eat natto, but you should be careful not to use too much of the sauce. Maybe use only half of it, for example. Being mindful of this is very important, and the second ingredient that's getting attention is something called polyamine. It's a nutrient that's being praised with words like rejuvenation and autophagy. In Spain, there was a study conducted on 829 residents and those who consumed a lot of this polyamine. The group had about 40% less fat than the group that consumed less, and a lower risk of heart or blood vessel diseases. Was also surprisingly 47% lower. That's the conclusion. The wording in the paper is interesting. The difference in taking this component called polyamine is equivalent to being 5.7 years younger in age. That's how they say it. Romantic, isn't it? Natto contains antioxidant substances. Taking polyamines might help you become younger, and this polyamine, which is an antioxidant, there are reports that fermented natto contains more of it than just regular soybeans, even though they're both made from soybeans. So if you're going to eat soybeans, it might be better to get them from natto rather than tofu or other forms. And finally, the last components that are getting attention are natto bacteria and dietary fiber. These two nutrients feed gut bacteria and impact the intestinal environment. They're expected to offer a beneficial stimulus. One study used 50 grams of natto daily. Participants continued eating it for 2 weeks, for 14 days. As a result, not only did the number of natto bacteria in the intestines increase, but also the number of bifidobacteria, which are representative of good bacteria, increased. And surprisingly, the number of bacteria belonging to the genus Clostridium, which are a type of bad bacteria. There are reports that these intestinal bacteria had decreased. In other words, natto is rich in dietary fiber. Dietary fiber serves as food for intestinal bacteria. And by adding natto bacteria to that, it's believed that the intestinal environment improves, increasing the good bacteria and decreasing the bad bacteria. A study in Japan found that when 205 people in Saga Prefecture took natto bacteria capsules, their intestinal bifidobacteria increased. Actually, the intestines are the key to immunity for fighting off germs. By keeping your intestines healthy, it leads to overall health. In that sense, natto plays an important role. If you've watched this far, you might be thinking, okay, I'll start eating 3 packs of natto a day. Some of you might be getting fired up about that, but please hold on a second. Actually, there's something important I want to add from the 2025 study I mentioned at the beginning. Eating a few packs of natto per week, anywhere from 1 to 6 packs, people who ate natto 1 to 6 times a week had about a 40% lower risk of death, but for those who ate natto every day, there was no statistically significant difference compared to those who didn't eat it. Numerically, the risk of death may decrease by about 32%, but statistically, this difference was not significant. I think one of the factors is probably the salt content. If you eat natto every day, each pack contains about 0.6 to 0.8 grams of salt. For people with high blood pressure, the recommended daily salt intake is less than 6 grams. If you add the sauce to a regular pack of natto, you're using about 1/6 of your daily salt allowance. If you keep consuming it at that rate every day, you'll end up taking in too much salt, which can lead to high blood pressure. And as a result of high blood pressure, there's a possibility that your risk of future illnesses will increase. So, here's my suggestion. How about buying a pack of 3 natto once a week? If you consume 3 packs in a week, that's 3 over 7 days, so it works out to about 1 natto every 2 days. When you go shopping once a week, just put 1 pack of natto in your basket. This way, you won't forget, and it most reduces risk of death according to data. This corresponds to how often you eat natto. Everyone, please let me know how often you eat natto, and if you have a favorite natto brand, please share it as well. I like natto with strong kelp broth flavor and enjoy dishes like natto pasta and natto cabbage salad. I create and enjoy top recipes with extra dietary fiber. Natto, cabbage and seaweed salad is really delicious, so please give it a try. If you have recommended recipes, let me know in the comments. As an active doctor at YouTube Medical University, I share videos to help you stay healthy starting tomorrow. How can you lower your risk of getting sick before illness starts? Hospitals rarely discuss this. I share knowledge not easily found in hospitals and aim for 1 million subscribers. I'd be really happy if you could subscribe to the channel so you don't miss any new videos, and if you like this video, please give it a thumbs up, or if you don't, feel free to give it a thumbs down. I'll use your feedback as a reference for my next video. Well then, see you in the next video. As a general practitioner, my patients have shown me how to stay youthful after 70. I want to live this way too. It's truly possible. These words reflect lessons I've learned from many patients. Is chatting with friends more important than exercise? In medicine, less is more. My seniors taught me these lessons.